Okay, so let's speak about how to counsel a patient about any medical procedure. So as any station, we will start by the same introductions. Introduce yourself to the patient, confirm their identity, and confirm agenda of the meeting and take permissions. Please always don't forget about taking permissions. I always say that no one asks, is it okay to discuss with you regarding your medical condition or not? Please ask these questions, and then we'll ask how much do you know about your conditions. This extremely important questions. How much do you know about your medical conditions? So it will save you lots of times, and the patient will tell you most of the things that written in the task regarding the symptoms and disease. So will tell you, for example, I have blood in my urine and it's whitish in color or brassy, and I came to see you and you told me you need to do a certain procedure for me. That's why they asked me to speak to you today. So say thank you for sharing this information. If you couldn't find like sympathy, whatever the patient telling you, either do sympathy or empathy, offer reassurance, use positive language, like praise them. Uh, uh, for example, I told you thank you. If I told you something not very exciting, like just for us urine, for example, alone, thank you so much for sharing this information with me. But if she told you I had a urine in my blood or I had heart attack, anything you think it's serious, it could frighten the patient. So please say, I'm really sorry. This could be very frightening for you. Please don't worry. We are here to support you and offer reassurance at the same time. Like acknowledge the feeling, offer reassurance. And then so he told you the symptoms. So the first thing we need to explain the disease or the suspected disease. It could be like not confirmed yet, but we suspecting he could have certain disease or certain GIT problem. That's why we need to do certain procedure. So just to be like organizing your talk and take yourself steps after the others. So we ask him about how much they know about their conditions. We're finishing by defining the whatever he missed. Like if he talked only about symptoms, I'm going to speak about disease or differential, or we suspecting certain medical condition, or suspecting that you could have some problem with your kidney, or like this blood in your urine and having frothy urine. It could be caused by different renal disease, and that's why, or different kidney, sorry, don't use medical jargon, different kidney diseases, and that's why we need to do a renal biopsy. So now just we highlighted the name of the procedures. And then I will ask him, have you heard about it? Because also he may also did it before. So why should be just explaining to him all the steps? He maybe did it before, and they could change the station for you instead of like explaining the procedure. It could be like convincing him to do the procedure. Maybe he did it before, and now he telling you, no, no, I don't want to go through this experience again. So we need to find out from the patient. Not everything will be written in the task outside. Some lots of important point could be only in the patient head or in the surrogate. So we need to find out the. So have you ever heard about it? He will tell you no or yes, depends on the task. He will never like go out of whatever they want you to do. Like so, if for example, he tell you, yes, I heard about it, but can you please tell me about it? Even if they want you to explain it in details, like the task of the station is to explain these procedures, even if he know it, he will tell you, yes, I heard about it, but if you don't mind, tell me more. So because he doesn't want you to miss your mark. But if the station is just about something else, like convince him to do it, for example, he refusing to do the procedures. So he will tell you, yes, I know it and I did it before. It was very painful and I don't want to do it anymore. So yeah, it will be, that is really important to know, have you ever heard about it? Or how much do you know about these procedures? And then we need to explain the procedure. So explaining the procedure itself, it has to be very simple, like precise to the point, one line about the technique. And then will be another line just about using the numbing medication to reassure him regarding the pain. And then when you explain the procedure itself, we need to speak about before the procedure, what preparation we need to do, and after the procedures, what expected to happen. And part of this, after the procedure, we have the complication. He could develop complication after the procedures. We need to be honest about it, and we need at the same time offer reassurance about these complications. So explaining the procedure, for example, renal biopsy. So I would say it's done by inserting a special needle into your back, guided by imaging or camera. And then we will take a small tissue sample from your kidney and send them to the lab for analysis. That's it. So it's just it's really important to tell that we use a needle, so he will not be shocked by seeing the needle when we take him to the theater room. So he needs to know that there will be special needles, and this is guided by imaging or camera, and we're going to take small tissue samples from your kidney and send them to the lab. But at the same time, when talking about needles, um, we need to speak about numbing medications. So we're going to use some numbing medications to numb the area and decrease the pain. So now the patient will be, ah, that's okay. So, and yeah, we should always like speak in simple language, avoid the jargon. And even if I use the jargon, I had to explain this straight away. If I said renal biopsy, so I would say like a tissue sample, like to take a tissue sample from your kidney. So you can speak about the procedure in the medical jargon, then start to explain it in details. Whenever you mention medical jargon, if you explain it straight away, that would be fine. But if you like you said the medical jargon and just took a deep breath and the surrogate asked you, doctor, what do you mean by this? Now you are done. You lost mark for jargon, because even if your intention was to explain it, just the patient ask you before you explain, it's a problem. That's why I would never give him a chance, and no one would interrupt you. Like interrupting is a rude. If you interrupt the patient, you will lose mark, and the patient will never interrupt you. So whenever you mention a medical jargon, just explain it straight away. By which I mean this, whatever medical jargon, by which I mean, and then explain it straight away. Because whatever, like a doctor, the thing that comes to your head, the first thing will come the medical jargon. So don't distress yourself and try to translate in your brain and be hesitant in your talking. No, say it, but explain it straight away. So renal biopsy, which is done by inserting a special needle in your back and then to your kidney to take small tissue samples and send them to the lab for analysis. Uh, and we, like as I said, like just because you mentioned about needle, you have to tell them we will use some numbing medication to numb the area and decrease the pain. And like another example, for example, endoscopy or OGD. Just we'll tell instead of the small needle we have here, thin flexible tube. You know, we need to say like this tube is thin and flexible, so just not get frightened. And honestly, in Sudan, it's not thin at all. Like had it or it's very big. But anyway, thin flexible tube with a small camera is passed through the mouth and down into your stomach. And sometimes we may need to take some tissue sample as well in the OGD. We need to mention that as well. And as I said, we straight away, whenever we mention about any procedure, define it, we need to reassure that we're going to use some medication to numb the area. And then, as I mentioned before, we need to speak about before the procedures, just preparation. You may need to stop certain medications such as blood thinners. Also, like some preparation could be doing some blood samples, and it depends on the procedures. But always remember There could be preparations, and one line is enough. So just tell the examiners, I'm aware that any procedure has preparations and I have to warn the patients. There could be some preparations before your procedures. We will guide you. Even if you don't know or you don't have time to say, just tell him before your procedures, we need to do some preparations. We will guide you through this. And we also talk about the after the procedure. So after your procedures, you may need to stay with us for few hours or for 24 hours, depends on the type of the procedures, to look up for any complications. And just mentioning the word complication, I would say, as any procedures, there is a small risk of complications such as bleeding, infections, or injuries to the adjacent organs, which is very rare, but whatever, and offer reassurance straight away. Don't frighten him. So just you spoke about the complications, tell him we will take every precautions to minimize these complications. Please don't worry. And also you can say this procedures is routine or standard procedures. We've done it lots, like hundreds of times, and we have a very expert teams. And please refer to my video regarding offering reassurance. I already mentioned that I have very good sentences, so please listen and memorize by heart. Please, please, please. I always tell you that I'm just doing all this time for you guys to help you by all means, but I don't see you like using the sentences, and I'm using these sentences from like different resources, including like my previous teaching for communication. So please, I'm teaching native English, which use very excellent sentences. So please refer to them and learn them by heart. And then we need to finish after offering reassurance, the consent, and then we will say, for example, if you agree to this procedure, you have to sign a consent form in which all the information we mentioned is there. So you need to tell him this consent is informed. And the second thing, he has the right, and you have the right to withdraw at any point if you change your mind. And then few questions about social service, as we mentioned before. And then may I know what is your main concern? Always don't forget the concern, please, and address the concern as they arise, and check understanding. May I know how much did you get from our meeting today, and offering extra help, support. I will give you some leaflets and brochures and websites to be more aware about these procedures and its complications. If you have any worries, please feel free to contact us. I will give you our department number. That's all. Thank you, and please keep practicing, keep study, keep memorizing by heart, and best of luck, everyone. Do you have any questions?
Thank you very much, Dr. Afama. We really appreciate it.